appreciate you asking about how we might practically bring what we've learned from intersectionality into the clinical room, into the therapy context, because it's something many people are interested in doing, but there aren't many guidelines or rule books about what in real life, in real time, this can look like. There are two different considerations, areas that I think we can increase our sensitivity to intersectionality as therapists. One is we, of course, have to just continue to increase our cultural awareness and competency of the unique issues, patterns, problems, concerns, resiliencies that show up not just in these broad marginalized communities, such as women or people of color or people with disabilities, but we need to begin to develop more nuanced cultural competency as it relates to some of the unique struggles of people who hold multiple marginalized identities. And so that's step number one, because any sort of way of engaging with sensitivity often requires some knowledge, right? These very clients who have multiple marginalized identities are often, one of the struggles they may have is being regularly misunderstood or feeling invisible. And so one of the best things we can do as clinicians is to show that their experience is not totally invisible to them, that you can not only relate to and understand, but sometimes maybe even predict some of the challenges that they may have. Now, that said, cultural competency is only half the battle if we don't know how to share and deliver that competency in a way that feels nice, that feels right, that feels healing. And so I often talk about how we can begin to use our cultural competency and make hypotheses or share ideas with clients in a way that is open for them to identify or disidentify with it. So let's take some examples of what this could look like. Let's say you're working with a gay man with physical disabilities, with a physical disability. You know that gay men who have some sort of a disability, particularly a visual disability, often report experiencing some form of stigma or ableism and rejection in the LGBT community. If I wanted to invite a client to talk about this, I might say something like, you know, I know that some gay men with disabilities report experiencing ableism and rejection, especially in more appearance-focused segments of the LGBT community. I also know that some people with those experiences, with those identities, don't have that struggle and feel very accepted among other LGBT people. What's your experience been? Right? This is a way that I can share a potential experience, something I know is a common struggle from my cultural competency, without telling the client that I think this is your experience and you should just tell me how it fits into your life, right? It's an invitation, not a prescription. So let's take another example. Let's say I'm working with an older woman and I want to talk about an area of cultural competency that I have, which is that I know that older women face sexist, misogynistic beauty standards that are often based on youthfulness. I might say something like, you know, some of my female clients have talked about how they've started to feel invisible or less womanly as they age, because society focuses so much on women's appearance and how youthful they look. But other female clients I have do not report this at all. They really enjoy getting older and embrace aging. And I want to explore for you where you fall. What is your relationship with aging? Here again, I'm sort of giving the client examples, in fact, polar opposite examples, and saying, do you identify with either of these or somewhere in between? And by doing that, I validate that any response is okay. I've heard and accepted responses that are similar to this from people in the past. I know that a range of experiences exist. You tell me where you land. So let's take another example. Let's say you're working with a person who is Muslim and also identifies somewhere within an LGBTQ plus experience. And I know from the literature, from research, and from my experience within various communities that some LGBTQ Muslim individuals view their sexual orientation and their religious identity as somewhat incompatible, that there's friction or tension between them. I might tell that individual, drawing upon my cultural competency, and say, I know that some LGBTQ plus Muslim individuals tend to keep their sexual orientation and their religious identities totally separate. But I also know, on the other hand, that there are individuals who don't see them as incompatible, don't keep them separate, and have really integrated their Muslim and LGBTQ identities. How does this play out for you? Right? And so in these examples, you can begin to see how I can anchor and give broad examples that relate to two identities at the same time and allow people to self-identify. I'm going to give you one more example. So let's say you are working with a Black woman in therapy, and that you've already talked a little bit about broader experiences of racism that this individual has faced, but you want to begin to explore and inquire about whether any of the stressors that they have related to race are actually also connected to other identities, such as being a woman. I know as a clinician and just as a human in the world that many Black women face stereotypes, prejudgments, that they're angry, right? This notion of being the angry Black woman that many African-American women experience as a trap or a role that they get put into, no matter what they do, sometimes no matter how polite they might try to be, and especially in situations where they assert themselves. So I might bring this into a therapy session by sharing with my client, I know that some Black women feel that they are constantly viewed as the angry Black woman whenever they assert themselves. Whereas other Black women don't experience that stereotype very often, and that's not something that resonates with them. What's it like for you, right? This is a way of giving an open-ended question that allows your client to either say, yes, that's my experience, or say not so much, right? Because you have put on the table that that it's true for some people and not true for others. The last thing I want to talk about is that one key strategy I use to build resilience and strength among not only my BIPOC clients, but all clients who are marginalized, and in particular, those who are facing multiple marginalized identities, is that I will often ask them to reflect upon and think about other people in the world, maybe notable figures, people in history, or even just local community members who they admire, who have persevered, who hold the identities that they have, right? Because what we find is that no matter what group you belong to, even some of the most numerically small segments of our population, there are usually excellent examples of people from those experiences who have, despite the odds, despite the world and the cards being stacked against them, have persevered, have acted with great courage and creativity, have accomplished great things that the client might admire. And so, for example, I've done a lot of group therapy work with LGBTQ people of color. And it is very easy, even for people who are not incredibly familiar with LGBTQ history, for many of the clients that I work with in those groups to think of really admirable and courageous examples of the ways that Black or Asian or Latinx or Indigenous or multiracial LGBTQ people have shaped the world, have survived despite hardship. And when we talk about those examples, we can begin to build the resilience of those individuals by them remembering that they come from and belong to a community of people that have immense strength and who have survived despite many, many hardships. And maybe, just maybe, they can do the same. And so this is a really important tool that as we're digging into why these identities are hard, why there's so much struggle, why there's so much pain around these identities, that we also build up the part of them that is a survivor, that is strong, that has found a way to seek liberation, even in a world that's very oppressive.